Criminology Board Exam Reviewer. Forensic Medicine. Definition of terms. Part 3. Code of Hammurabi. It is the oldest known medico-legal code. Coma. It is the state of profound unconsciousness from which the patient cannot be aroused. Concussion. It is the sudden shock to or jarring of the brain which may or may not cause a loss of consciousness. Conjunctiva. It is the delicate mucous membrane that covers the exposed surface of the eyeball and lines of the eyelids. Contact wound. It is a wound that results when a small weapon is fired in contact with the skin. May divided into tight or loose contact wounds based on the amount of pressure used against the skin. Contusion. It is a bruise that is either superficial or internal. It is an injury caused by blunt object impact without laceration with surface discoloration due to subsurface hemorrhaging. It is an injury to subsurface tissue caused by a blow from a blunt instrument that does not break the skin. Convulsion. It is a medical condition where the body muscle contract and relax rapidly and repeatedly, resulting in an uncontrolled shaking of the body. Cornea. It is the transparent membrane that covers the colored part of the eye. Coronary artery. It is an artery supplying blood to the heart. Coroner, medical examiner, pathologists. It is an officer responsible for determining the manner and cause of death. Corpse. It is a dead human body, also called cadaver. Cunnilingus. It is the oral stimulation of the female genitalia. Death. It is the loss of life characterized by clinically combined failure of respiratory, cardiovascular, and nervous system activity. Decomposition. It is the post-mortem degenerative rotting of the corpse. Chemical breakdown, separating compounds into their component parts, includes breakdown of proteins by putrefaction, of carbohydrates by fermentation, and of fats by rancidification. Decubitus. It may be seen as a bedsore that can produce an ulcer in the body caused by lying long in one position. This pressure necrosis can be found on elderly patients. Defense wounds. It is a stab or incised wounds to the hands, wrists, forearms, and arms that may contain embedded fragments of the weapon. Delirium. It is extreme mental excitement marked by defective perception, impaired memory, and rapid succession of confused and unconnected ideas, often with illusions and hallucinations. Delusion. It is a firm belief opposed to reality but maintained in spite of strong evidence to the contrary. Diatoms. They are microscopic, unicellular, silica-coated algae. Presence of diatoms in tissue is a sign of ante-mortem drowning. Diatoms are examined by acid digestion technique. Dipsomania. It is an irresistible desire for alcoholic drinks at periodic intervals. Durham Rule. He is an accused person is not criminally responsible if his unlawful act is the product of mental disease or mental defect. Ecchymosis. It is the medical term for the common bruise. Most bruises form when blood vessels near the surface of the skin are damaged, usually by impact from an injury. The force of the impact causes your blood vessels to burst open and leak blood. Eclampsia. It is an acute disorder of pregnant and puerperal women, associated with convulsions and coma. Embolism. It is the obstruction of a blood vessel by foreign substances or by a blood clot. Endemic. It is a disease that occurs continuously in a particular population but has a low mortality rate such as measles. Endocarditis. It is the inflammation of the lining membrane of the heart, may be due to invasion of microorganisms or an abnormal immunologic reaction. Epidural hemorrhage. It is the bleeding in the space between the dura mater and skull or wall of the vertebral canal around the spinal cord. Epistaxis. It is a hemorrhage from the nose, nosebleed. Erythrocytes. They are red blood cells. a type of blood cell that contain a nucleus in all vertebrates but man and that has hemoglobin in the cytoplasm. Erythroderma. It is the intense, widespread reddening of the skin,